accessible prescription labeling legislation. I am Charlotte Glass. I work with Envision America. I've been with Envision America for about 15 and a half years now, and I've done a lot of different things: customer service, purchasing, accounting, working with advocates, and most lately, I'm the database manager for the IDmate, and I am working on community outreach and public policy. I don't have any background before this in lobbying or anything like that. It's just Dave was like, hey, somebody should be keeping track of everything that's going on, and you're going to be the one to do it. So I have dug into some of the history of accessible prescription labeling legislation, and I try and keep track of everything that everybody's doing and be as much of a support and a resource as I can, because not only is it in our Envision America's best interest for legislation to be passed, but it is in everyone's best interest, because everyone at some point in their life probably would benefit from having an audible label. So I'm just going to start out with a brief history of what I know of the accessible prescription labeling legislation. And then I'm going to go into what I know is going on right now. And then I will open it up to questions. And if those, who are here, who are currently working on legislation, want to have, a little, tell us what you're doing, that would be amazing too. So just a little bit of background. This is not something new. I think almost everybody here is familiar with the Rehabilitation Act and the Americans with Disabilities Act. The Americans with Disabilities Act in 1990, it did say that accommodations need to be provided, but it wasn't very specific to the pharmacy. So that actually came later in 2010, when the amendments kind of specifically stated that pharmacies were it just clarified the instructions and how they can provide public accommodations, specifically providing auxiliary aids and effective communication. And it listed specifically large print, braille, or accessible electronic and information technology as possible solutions at the pharmacy. Just before that, in 2003, the Medicaid Prescription Drug and Improvement and Modernization Act, there was a little line in there that said that the Department of Health and Human Services needed to do a study to find out more about how people with vision loss were managing their meds. And so they partnered with the AFB, and many of you maybe you were even part of that study back in 2003. Many people provided information about how they take their meds, what tricks and everything that they use, what their struggles are, what are some of the dangers, and that kind of thing. Nothing really happened beyond the AFB survey, because there wasn't any money actually given to Department of Health and Human Services to act on the information that was provided. And they said, well, the AFB did a really great job in putting together their website, and so they kind of left it at that. In 2012, the Food and Drug Safety Administration of Safety and Innovation Act, there was a lot of components to that, and one part of that was it stated that the United States Access Board needed to provide best practices. So to come up with some best practices to inform pharmacies of, what is the best way to accommodate the blind and low vision and elderly at the pharmacy counter. So there was a committee put together. It included representatives from most of the major pharmacies, Envision America, we sent someone to that conversation as well. And then based upon all the feedback, they came up with some best practices. So basically for each of the categories that were stated in the ADA, large print, braille, and accessible electronic means, or audible is basically what it came down to. They stated some criteria that should be, there. So for example, for large print, it should be a certain font, don't use this font, use this size, for braille, this is the best braille to use, etc. Because that was required by Congress, they also wanted to find out what happens with that information. So in 2016, the Government Accountability Office then was supposed to do a report, and they surveyed a bunch of people and pharmacies to find out how the implementation of the best practices was working out. And their conclusion was actions are needed to increase awareness of the best practices. So that report went back to Congress, and of course nothing really happened. And they never gave the National Council on Disability any money to really promote the best practices like they were supposed to. So kind of like the 2003 bill, not that much happened. But I think each of these steps, awareness is growing, and we have seen some progress. So when we really got a leap forward was in 2016 with the Affordable Care Act. Section 1557 was implemented. That it was the non-discrimination in health programs and activities final rule. It said that you have to provide effective communications for individuals with disabilities. You cannot discriminate. Any covered entity must provide auxiliary aids free of charge in a timely manner, and ensure equal opportunity to participate and benefit from the entity's health program or activities. So that means it was holding all covered entities to a higher degree or a higher standard than even the ADA. So a covered entity is anyone who gets federal money. So that would be like any pharmacy that provides Medicaid, Medicare, that kind of thing. So if they don't, or if you yourself are not one of their patients, then that does not apply to your situation. But overall, almost every pharmacy participates. And so whether you are or not a patient, they need to be prepared to accommodate a patient who is. And so we saw a lot of pharmacies starting to ask questions and come up with solutions, whether it's ours or another solution at that point in time. What happened then is that, more and more people realized, like, okay, we have these federal laws, but the prescription labeling is not federally what's the word? The federal government doesn't oversee prescription labeling on the day-to-day. That usually comes from the Board of Pharmacy in each state. So they regulate pharmacies and how they practice, and they're the ones who provide disciplinary measures or fine them, or make sure that they're living up to state statutes and federal laws. So many states have said, well, we need to have in state statute how our state is going to implement this federal law. And that seems, in the states that have implemented it, to be helping to increase the frequency of provisions. So the first state that passed such a bill was Nevada, SB 131, and that was in 2017. And they started out with some stronger wording and then made some compromises in order that it would pass. And so by the end, the wording basically said that pharmacies are required to tell people that accessible prescription or audible prescriptions are available and where to get them, but they are not required to provide them. So they can tell them, you know, you can call Envision America, or you can go to the pharmacy across the street, or they can provide them themselves. So it did increase awareness, but it didn't really increase the accessibility of it. Like, not that many pharmacies started providing it based on that law, but they were more aware of it. So in 2019, Oregon wanted to work on a bill that was similar, but they definitely wanted it to be in every location. And they worked hard, and they brought in a lot of people to testify, you know, that it needs to be in each location, especially, I mean, like they said, you know, in Oregon, we have pharmacies out in the middle of nowhere, and people can't just go down the street to another pharmacy. And they, you know, they need to have the service. So they might not have access to have someone come and be a caretaker or to manage their meds and on a weekly basis or whatever. So that bill passed, and I think there was a lot of conversation in that health committee at the same time, because a bunch of nursing students were working on a dual language prescription labeling law at the same time. And they had so much expertise in the prescription labeling field and the struggles that their patients were having managing their meds, not being able to read their prescription labels, but for the reason that they, you know, they spoke another language. But you know, the struggles were very similar. I mean, like, if you can't read them, you can't read them. So the answer is, you know, how do we make it so that people can read and obtain that information? And so that year, Oregon actually passed both of those laws. So now they have a dual language prescription label law, and they have the audible prescription labeling law. And then the following year, Nevada passed a dual language labeling law. So now those two states both have dual language and audible prescription labeling laws. So that's everything that I know of that has passed. But there are a lot of states that are working on trying to get laws passed. So I'm just going to go through the ones that are in committee right now. So this means the bill has been proposed and already assigned to a committee. The first one is Pennsylvania. So that's HB 89. They actually had a previous bill number from a previous legislative session, but of course it got cut short due to COVID. So the sponsor reintroduced it this year. And that is sitting on the committee chair's desk. We're hopeful that it'll eventually be seen, but I mean, like, this year, so many of the health committees are really focusing on COVID, vaccine, still a lot of opium epidemic, electronic prescription labeling laws and stuff like that. So we'll see. The second one is Puerto Rico, and that one actually passed their health committee, and it went to the Senate floor. And I haven't gotten any response yet whether that passed the Senate floor or not, but because I didn't see anything posted yet for their final day, if it even came up for a vote or not, the final day that they were in session before their summer break. But if they didn't vote on it, it's going to get voted on when they come back from their Senate summer break. And so that's kind of exciting. We have a new staff member this year that speaks Spanish. She's originally from, her family's from Puerto Rico. And so she's been working with a lot of pharmacies in Puerto Rico and reaching out to South America as well. So that's kind of fun. And then there was a bill in Massachusetts. I think that's died in committee. I don't think it's gone anywhere, but it did make it to, get assigned to a committee, and there was a hearing scheduled, but I'm not sure if anything really happened there. Like I tried to watch the committee thing, but it was mostly other bills that were being talked about. So I think that might still be on the docket. So those are the three that I know the bills have been proposed. Now I know there are quite a few states where I've talked to an advocate who wants to get bills. What happened there? Wants to work on a bill. And so I'm just going to list those. I have some advocates in Vermont, Texas, and New Mexico. My computer's doing funky things. Here we go. Maryland, Kentucky, Indiana, Hawaii, and Michigan. So I'm just kind of in conversations with those. None of those people are ready to like go and seek a sponsor yet, but they're just talking about what would it take. And then in Washington, New York, and Florida, I have advocates that are specifically looking for sponsors. Camille, I see that you're on the call, so if you want to say anything about what you guys are doing in Florida. And I don't know if there's anybody from New York or Washington, but I'm just keeping an eye on those as those progress. So. Oh yeah, Camille, you go ahead. Just give your 2 cents on where you guys are at and what you want to do.
Can you hear me?
Yes.
Hi, how are you, Charlotte? Where we are right now is we've divided our state into different regions and assigned team leaders, and we are reaching out to members of the specific committees to hear some of our issues, including accessible prescription drug labels. We've combined that with a resolution passed by our affiliate at last year's state convention, and we have really high hopes. And we've made contact with one senator, state senator, and there may be some interest on the House side as well.
Great. Thank you for the update. And Emily, yes, I did not mention Ohio, did I? So Emily, go ahead and tell me, do you have an update on what's going on in Ohio?
I'm in Pennsylvania.
Oh, Pennsylvania, sorry, Pennsylvania.
No, we have a meeting with Rep. Miller soon.
Oh, good.
What committee is that? Is that in the health committee?
Yeah.
Okay.
Yeah.
No, okay. Yeah, no, I have to, because then I can make some calls. We were actually working on early prescription refills too. So we're kind of at a point where we're trying to get like an overall blind healthcare package too. But no, Rep. Miller's been really great and a really strong advocate for us and on this in particular. So thank you.
So yeah, and the chair of the health committee is Kathy Rapp. So I was talking with someone who works at an independent living center, and he's like, "Oh, I'm a friend of hers." I was like, "Well, you need to talk to her about this."
No, that name's familiar too. I'm gonna have to look up where she is, and if we have people in the area, then we'll definitely. Because we got sidetracked with the voting thing, so I've been all about state committee, and kind of health committee's gotten past me. So you have to get on them as well. So thank you very much, and thank you for having this presentation.
Yeah, you're welcome. Yeah, so Ohio, I don't know if Eric Duffy or anybody from Ohio is in here. Ohio had a bill last year, and it went and it had a first hearing and everything, and then COVID hit, and of course things don't carry over from year to year. So they're even to odd years. So I haven't seen it re-proposed, and I'm hoping though that it will get proposed again.
What's going on in New Jersey?
I haven't heard anything from anybody in New Jersey. So should something be happening in New Jersey? Do
I
you
don't
want to make
know.
something happen in New Jersey?
No, I don't even know what they're doing because I've had a hard time getting, labels unless I do mail order. That's my issue. And a lot of places do not offer, I just got Walmart to do mine, but a lot of places are not offering it. It's like a real pain in the butt. You have to label your own,
Yeah. Well, I mean, any state or chapter that wants to work on reaching out to legislators, I mean, I encourage that just because it's a health equity issue.
I'm here in Wisconsin. Have you read anything about anything going on here with that, with all this?
No, I haven't.
Okay.
So
So
again,
I understand.
go ahead.
I'm sorry. I understand this is like a huge, because we're such a huge country, we've got all these states that are doing this in their own way and due to COVID and everything. I envy countries like in the UK. You can walk into a pharmacy, ask for a prescription, and it's right there on the box in Braille.
Yeah.
You don't even have to request anything. So I would love to see something like that in future here, just all across the board here in the US. There's a lot to learn, I think.
Yeah, that would be pretty amazing.
Sorry to interrupt. This is Bob. Did you want to take any hands up or questions that I have coming through the chat at this time, or do you want to wait?
Yeah, let's do that.
Okay, so we have Melissa Kane that has her hand up.
Hi, Sharla. I am in Missouri, and we talked about introducing an accessible pharmacy bill last session, and that didn't make our priorities. We had a few other things, but we are definitely planning on working on it this year. Do you have sample legislation that I can reach out to you and get so we can start getting that formulated and trying to find sponsors?
Yes, and I'm glad you asked that question because I wanted to share a website with everyone. I have shared sample legislation or links to all the legislation that I could find and on this website. So it's www.staysaferx.org. So that's just a blog that I help contribute to. And so I can send you that link later on if you can't remember that, staysaferx.org.
Okay.
So, and I also have posted up there suggestions for testimony so that, you don't just have like 10 people saying, this would really help me. There's suggestions on like ways to point out some of the different things like needing it at the counter, at the time that not having to wait 3 days, addressing, the safety issues, the cost issues, somebody's going to pay, but, is it going to be somebody paying, a medical bill from a overdose, or is it going to be, the pharmacy paying, or is it paying extra for a caretaker? So like, it just like kind of lists out a lot of different ways. And if you're having a bunch of people write testimony, maybe they can each, highlight a different aspect for the bill. And then we always post up on that blog to just whatever we hear is happening. We'll post up there, whether it's for talking prescription labels or dual language, or we just hear something that's, about safety, medication safety, we'll post it up there. So yes.
Thank you very much.
So, and then I also have another tool, and I will post it in the chat. This is like a PDF that you can, you know, print out or use if you're educating your committee or anything. So it goes through all the different federal laws. It has like high tech and low tech accessibility options. It even lists stuff on managing your meds if you're blind. And it goes through each of the best practices from the US Access Board. So it's a really great tool there. And that's on just a little MailChimp website that I put together so that I can send people that link. And it's great for sharing with pharmacists too. So it's kind of actually geared toward pharmacists and, you know, to educate them on the standards, laws, and solutions. So it doesn't just list script talk, it lists like all kinds of ideas. So that's a good solution there too. And I'll just put both the link to Stay Safe RX there as well. So both of those are in the chat if you want them. And Melissa, I will, you know, try and be in contact with you as well, because, you know, I can search my database and see if there's anybody else who has, you know, in Missouri who has expressed an interest, and then, you know, get some stakeholders together, you know, that might be able to work with you. Yeah, so 302 phone number, go ahead.
Yes, can you repeat this is Delaware. Can you repeat the website again? Stay safe?
StaySafeRx.org.
Okay. All right. Thank you.
Yeah. Anybody else have any questions or comments or want to share?
Yes,
Yeah.
hello.
Yeah, the 347 number. Go ahead.
Okay. The question is that do you have to pay for? I'm just getting on. I'm late. Do you have to pay for this talking prescription? Because I'm in need of it real bad.
So most of the pharmacies provide it as an ADA accommodation, which means that they do not charge you extra for it. So you would just need to find a pharmacy that provides the accommodation. So there's, you know, Script Talk, we work with thousands of pharmacies, but there are other solutions out there as well. So, you know, CVS has their own solution, Walgreens has their own solution, Walmart uses ours. We work with the Albertsons chain, as well as most of the major mail orders are providing Script Talk as their solution too. So if you want help finding a pharmacy in your area, I suggest you just call us because our customer service team is awesome. And our number is 800-890-1180. You can also find us online at envisionamerica.com. We're also in the, if you're using the NFB app for the convention, you can find our booth and just stop by our booth too.
Okay, well, thank you.
We have a question from Corey.
Hi, Corey, go ahead. Corey, you'll have to unmute. All right, I think Corey left.
Yeah, I think he left. So we have a 347 area code.
Are you guys there?
Yeah.
Yeah, can you spell the website again?
So
My
it's
last name is Will.
So can you spell the website?
Okay, the website is
StaySafeRx.org. Oh, safe? SAY?
Yeah, stay safe. Like, don't get
Oh,
hurt.
stay safe. Okay. Do
And
you
then
do for
talk.
small pharmacies? Do
Pardon?
you do for small? You do small pharmacies too, or no?
Yeah, so we're
Okay,
happy
go
to
ahead.
work with any pharmacy that wants to provide it.
So
Yes, it is.
stay safe. Correct.
Yeah, so that website is just a blog that talks about different what's going on legislative wise in the country. So I
All
mean,
right. Thank you.
yeah. Yeah, our
or
website
your
is
friends are
reasonable.
contributing to your
Okay. Next, raised hand is a 212 number. Are you still there?
Seem to have disappeared.
Yeah. Okay. Patricia.
Yes, I just needed to repeat the phone number again.
Okay, it's 800 890 1180.
890-1180, 800.
Yep.
Oh, okay. And I just have a one question also. How we have an advocacy committee in our city here in Columbia, South Carolina, and I'm really interested in contacting my legislators to see exactly what we have here in place for accessible pharmacy medications and stuff. How do I start? How do we start?
Yeah. Well, I would be happy to have a whole conversation, if you wanted to just brainstorm, but what I would say is, if you have an advocacy committee already, that might be a good place to start that conversation of like what people know is already happening. As far as I know, there isn't anybody pursuing legislation. So, finding a legislator to sponsor a bill would be a great first start. And then from there, finding other legislators to back the bill and finding other stakeholders. So I think matching up with other stakeholders was a big success in Oregon because they had other organizations that were really supporting those bills, like the AARP and for the dual language bill, they had refugee organizations. But for an audible prescription labeling bill, you might be able to partner with like a dyslexia group or traumatic brain injury groups or anybody who has seniors dealing with senior citizens, because they are all dealing with the same issue of how do we read our prescription labeling. So that whole legislative process, if that's new to you, that's something that we can certainly talk more about, if you're not familiar with that. But if you have a committee that's already working on that kind of thing, that would be a perfect place to bring it up and see if multiple people can work on it at the same time.
Oh, okay, that's a good idea, and I would like to talk to you extensively about it. But
Yeah.
Those are good ideas.
Yeah, so you can call it another time with the 800 number and just ask for me, and we can do more brainstorming. And I think that some of these other people here that like Emily and Camille, who are on legislative committees, they've done this multiple times, like more times than I have even, I'm sure. So they would be a great resource as well, tapping into some of the NFB legislative committees.
Okay, and excuse me, because I came in late. I don't know your name.
Oh,
What is your
it's
name?
Charla Glass.
Charlotte Glass?
Yeah.
Okay, all right, thank you much.
You're welcome, Patricia. All right, so our 212 person with their hand up. We lost you before, but go ahead now. You'll have to unmute. Yeah, I don't know. There you go.
Yeah. Okay. I don't know how to deal with multiple over-the-counter drugs that I have to use and take. There's no way that I can read those things. And people tell me there's something called a barcode reader, but they cost really considerable money that I understand that insurance doesn't pay for, and they should really.
Yeah. Unfortunately, our ID Mate barcode reader we discontinued this year. There wasn't enough demand. People were using their iPhones more. But there are a lot of other solutions. I know some people are using way around tags. If it kind of is on a pharmacy by pharmacy basis, some of the Script Talk pharmacies will, create Script Talk labels for over-counter meds that you buy from them. Some say you have to have a prescription from your doctor telling them how much the dosage is for you, because they don't want to be liable for deciding your dosage on those things. But then once they have a prescription in hand, they'll go ahead and make the Script Talk label. So but that kind of goes from pharmacy to pharmacy. Not everyone does it.
Well, I don't have any technology, so I'm, just reliant on things like what you said about a barcode reader, but I didn't know that you discontinued them.
Yeah, unfortunately, when we have a couple refurbished ones still in stock, and I saw some on eBay. But
and you what?
Yeah, I saw some on eBay last week. So.
Will they still work if they're?
I mean, we still do database updates for them.
Oh, yeah.
So.
Can I call you about it? Because I find that I really need something like this. Yeah.
Yeah. Go ahead and give us a call.
Again, so your number was the 800.
890-1180.
890. Say it again. 1180.
Correct.
Okay. Yeah. And what I've been doing is just calling the manufacturer and asking them to read me everything on the label, but that's not always convenient, and they don't always.
Right.
Yeah.
Some places are starting to use those smart labels, and it's a tiny little QR code that takes you to a website. So if you have a smartphone.
I don't have a computer. I don't have any technology.
Okay. Yeah. An ID Mate might be really amazing for you then if you can find one. I think we have a couple in stock, but they're just refurbished ones.
That's all right, right? I'm kind of getting refurbished myself. So old, so yeah, I see. So maybe I could call you, separately about that.
Yeah.
Rather than take the time of the meeting.
Yeah, and we have a customer service person will answer that line, and they can all help you. So. We have a great team.
Okay, thank you.
You're welcome. All right, so I think Corey Wills was next. Do you have something else, Corey, to say?
Are you guys able to hear me?
What was that?
Go ahead.
Are you guys able to hear me?
Yes, we can hear you now.
Yeah, okay. I got a question. Did you say that Indiana has a bill for the accessible?
No, there's no bill put forward. I just have some advocates that are interested.
Do you know what the advocates are?
Well, one of them is a professor at one of the universities, so she's professor of OT.
Okay.
So she's just kind of curious.
Okay.
But you know,
Okay.
it's not gonna
Okay.
be her main thing.
Right. And then also, are there partnering with companies that do Braille medications or not?
I don't know in the United States. I know, I mean, obviously there is some companies because they have them, they're required by law in UK. So.
Well, the reason I'm asking because I'm starting up a Braille business, and I was wondering if I could take on this contract or job or whatever to where that they would say, okay, you know, we need 500 labels of this drug and this drug and this drug, and all they have to do is, email me the list, and then I modify it, and then I Braille it out. So I did not know if you knew of any who I can talk to or what,
Yeah, I don't know about, we don't really work with the actual manufacturers of drugs, just with the pharmacies themselves. So.
Right. All right then. All right. Thank you.
Okay, next up, it's a 302-734 number.
Yes, ma'am. I have a question. I feel for the young woman who just came on about the technology and stuff. Is it frowned up on if your state affiliate would like maybe purchase one of those pens and give it to somebody? Could that happen?
I mean, as far as Envision America, we've seen that happen. We've seen Lions clubs, we've seen affiliates, we've seen people be getting scholarship or money, all kinds of things. So whatever works.
Yeah, I wonder if she couldn't, go to her affiliate or even her chapter and see if they could, help her purchase. I don't know if everybody has a Lions Club, but they take so long too.
Yeah, I've
to do, some of them to do things.
Buy devices for people to.
Yeah, but they take so long, depending on what y'all have to go through. But I would think, I would just think that the affiliate, that's what we fundraise and we call ourselves family. We're a family. If somebody's struggling, why can't they help to do something like that?
Yeah, so she could certainly talk to them. We have definitely had people who got like technology loans or technology grants from their chapter or their state. So I think every state's kind of organized differently and how they run that kind of thing, but it's certainly worth asking about.
Yes, thank you.
Thank you. Anthony, you're next.
Good afternoon. To answer the preceding lady's question, I'm here in New Jersey, and in New Jersey, they did give me a pen friend, which is like a something that you could record a voice label on and attach the tag to whatever you wanted to label, whether it was medicine or clothing or whatever. But what my question is, it's two questions. The first question is, does anyone have a 30-day, a monthly medicine chest type thing that's labeled in Braille? So you can tell, day 1 from day 2 to day 3 to day 28, 29, 30. And second of all, a lot of places advertise that for a fee, they will put your meds together for you. However, the dates are not in Braille. I mean, if you take the same medicine every day, the dates really doesn't matter as long as you have 30 or 31. But that's what I was wondering. So Thank you very much.
All right, well, I do not have an answer. So anybody out there have an answer for him? You know of a medicine organizer that's monthly and also labeled in Braille?
This is Caroline. I don't necessarily have a monthly thing, but I have a thing that I fill up weekly. And for me, the meds I take are in different things. So for me, it's not much of a problem what I have to take because they're all in different things that I can distinguish them. And I have a thing that I fill up weekly, and it just has A's. You just have to turn it a certain way. A's are on one side and B's are on the other side to kind of symbolize the AM and PM sides. And you can fill them up for a week for morning and evening meds. That's what I have. I know for your information, those you can easily get at CVS.
Okay. All right, thank you, Caroline. All right, well, Anthony, if I see anything, and if I come across anything, I'll reach out to you and let you know. But I don't know anything offhand, so I'll keep my eye
Thank
out.
you. Thank you. I mean, it's a straightforward thing that people who are not visually impaired have access to, and I believe we should have access to the same thing, even if it's written in embossed large print. I mean, I can feel that. I can't see it, but I can feel it, and I think that would be helpful for most people. Maybe I'm not explaining it correctly, but there is an urgency there for it.
Yeah.
So I'm going to mute.
Is your email ajvecchi@gmail.com?
Yes, and you pronounced it correctly.
Okay.
Yes.
All right.
Yes.
I will just, if I find something, I will reach out to you on that. So.
Oh, thank you. You'd be surprised how many people mispronounce my name. But that's fine. Thank you.
You're welcome.
This is Sharon.
Yeah. What
are you there, Charlotte? About I don't know, 6 months ago, I went into my pharmacy and they did sell. It came in a cute little book, little thing, a bunch like 4 Braille labeled 7-day week compartmented little tiny boxes in a cute little book thing that you keep them in, and they were labeled in Braille.
Oh, and
so
what pharmacy
sometimes
is that?
Well, it's here in the middle of Kansas. You'll never. It's here in the middle of Kansas. It probably wouldn't do much for me to tell you what pharmacy it is. It's not a common pharmacy.
Okay, but there's something out there.
Yeah, there is, and I'm pretty sure I've seen a bigger box years ago that had Braille labels, a whole 28-day thing. But like I said, that would have been clear back in the probably 2008 or so. So I know they're out there, and I bet if you just can get somebody to look up compartmented pharmaceutical, whatever you call them, medication holders with Braille labels, you'll probably find a ton of them. I can't even get the words out.
You can do a search later. I can do a search later too.
Yeah, I'm sure they're out there because, anyway, that's all I know.
Okay, thank you for sharing that. Kay Rolfe, you're next.
Yes, hi. A couple points. There is an accessiblepharmacy.com out of Pennsylvania. I'm in Delaware. They have registered with 50 states so far, plus I believe Puerto Rico and Mexico, to be certified in their state, and they're certified in about 42 states right now. The founder is totally blind, and they send prescriptions out. They work with all insurance companies, and they do send prescriptions out to in any form you need them, and they'd use Script Talk, and I think they have a couple other companies, but they're in Braille. They have different sizes. They'll give you your medication for morning, noon, and night. Plus, and they're in separate. They're in a tray in separate compartments for morning, noon, and night. Plus, they have their vitamins as well. They have vitamins that you normally would take. They also put them with your prescription. So you have what you need for the morning or afternoon or evening right there. You just have to take it. Now it's in Braille, it's in large print, it's in, it has, you can use Script Talk to read it. And they have round ones and square ones, all different types. So they work with, you can switch over from any of your pharmacies to this one pharmacy, and they'll take care of your needs being blind. And the second thought is, yes, like the gentleman was asking about the Braille pill divider. I've purchased several from Walgreens. They sell them as well that have Braille on it for a month. So they do have them out there. But anyway, this accessiblepharmacy.com is very helpful and very nice to deal with. And you can talk to them and ask them any question you want.
Yeah, and they have a booth during the convention. If you're using Crowd Compass, the app, they do have a booth. I think somebody was in here earlier that from Accessible Pharmacy. So yeah, they provide Script Talk, they do pill packs, they do all kinds of stuff. So I think they just kind of talk with you and see what your needs are, and then work with you on, getting you your meds in the format that you need. So
exactly. You could switch over from any pharmacy, and they work with all insurances. So
yeah.
And they'll send them to, even if you live in different states, or if you move to whatever state, they'll send them to wherever you are.
Yeah,
So,
their mail order. Yeah.
so anyway, thought that might
Thank
help.
you. Yeah.
You're welcome.
Okay, we also have a comment from a participant in the chat about going to the Braille bookstore. It's an online store selling all sorts of home health aids. You may be able to find the medicine organizers there. Braille bookstore.
Okay, great. And let's see. I'm just reading a question here. Is there anything that prevents pharmacies from charging for Braille labels? Can we ask for labels on non-prescription items? So, okay, according to the ADA, pharmacies should not be charging for accessibility. So they can't charge, for an interpreter. They shouldn't be charging for Braille or Script Talk or anything. Now, is there anything other than the law to stop them? No. And you can report them to your state board of pharmacy if they are. That's or Department of Health and Human Services. You have to go the legal route then if they are charging you, because they shouldn't be. Yeah, asking for labels on non-prescription items, like I mentioned before, it varies from pharmacy to pharmacy as far as Script Talk pharmacy providers. So I know there are some providers that will, but then there's others that won't. So it really is like up to your pharmacist on how they implement that and whether they'll label those or not. So all right, any other questions or comments?
Hi, my name is Robin from New York.
Hi, Robin.
Hi. I use a tiny, and I mean tiny, it's a really small room, little ethical pharmacy that's in a medical building. And I love them because they deliver. So I get rid of one problem by being able to get free delivery from them, but I can't read my prescription labels, and they're basically eye drops. So, I mean, I only take 2 different pills and I know what they are from the shape. But the thing is, on an eye drop, you don't put the label on a bottle, you put it on the box.
Mhm.
And I keep telling the main pharmacist in there, I can't read the labels. And she goes, well, we make the labels so that your name is really big. I said, I know my name. I don't need to know my name on the
Oh, that's
label.
a good one.
I need to, even if I use my like 15 power magnifier, I need to be able to read how many refills. I need to be able to read, I can just about make out the name of the pharmacy, the name of the medication. But the little things like the amount of refills, the date that I have to, to order the next one, things like that, they're so tiny, but it isn't even the size. It's the fact that some things are very boldly typed and some things are very scantily typed. They're like a gray type. And I can't get her to change it. I bring up the ADA. She doesn't understand anything about that. And I don't know where to go from here. And I told her, I said, if you can't accommodate me, I'm going to have to go by mail order. And I've been a customer of yours for 40 years, even though she just took over the place. But I've been a customer at this location for 40 years because I've lived in this area for 40 years. And I found them and they were great, and why change? So I don't know what to do.
Yeah, I mean, we could
And
certainly
I'm
reach
an
out to
advocate.
them.
I do a lot of advocacy work, but
It's
not,
not gonna
I don't
go
know
very
where to go
far,
with
I'm afraid.
this.
She's not gonna get very far. I can't get far here either.
Well, it's all about
Yeah.
education though. So, I mean, we could certainly try and educate them and give them send them a sample of what this is like,
Do you want the name of the pharmacy?
Yeah, so you said ethical pharmacy?
It's called an ethical pharmacy. That means it only sells, it's not like a Walgreens, or it's not a big store.
Oh, I see.
The name of the pharmacy is called Smithtown Prescription Center.
Huh.
And they're in a town in New York on Long Island called Smithtown. And they're lovely people in there. I just can't get them to change.
No. Yeah, it's not gonna happen.
Thanks.
Well, it might.
I've tried it at mine. It won't happen.
Robin.
Yes.
Would you mind?
This was muted.
Because I want to be able to follow up with you. Do you want to send me in the chat your contact information? And
I will try to do that. I'm not very good with that, but I will try right now.
I mean,
Okay,
unless
so
you want to publicly give it to me.
I'll publicly give it to you.
Okay, go ahead.
What do you need?
Well, just your phone number. Probably.
My phone number?
Yeah.
Oh, my cell number. I'll give you my cell number. My name is Robin, and my cell number is 631-987-6811.
Okay, so I'll just have one of our customer service people call, and they'll work. This is what they do every day. So
great.
they'll work with you and contact the pharmacy and send them some information, and they know all the questions that are usually asked. They know all the answers. So
thank you very much, Charlotte. I appreciate it.
You're welcome.
Have a nice day then.
Thanks.
Take care now. Bye.
Okay, this is I guess you time-wise, another minute or so left in this session.
All right. Anybody else have a last minute question? Okay, well, I just want to say thank you to everyone for coming and stopping by. It was nice to talk with all of you, and feel free to contact us or check out the staysaferx.org if you have more questions about legislation. All right. Have a great day, everybody.
Thank you. You too.